You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. With us, we have the go-to cosmetic dentist. She's a board-certified prosthodontist. We've had her on the program before. Her before and afters, and you got to stick around for these before and afters. They are absolutely amazing. They don't even look like the same people. So with us, we have Dr. Nicole Mackie. Dr. Mackie, welcome to the program. Welcome back.
Thank you so much for having me, Randy. I am really excited to be here.
Now, we literally have been trying to get you back for at least a couple of years, so thanks for coming back in. And
Thank you.
I know you brought a lot of photos, so we'll try to get to as many of those as we can. Now, for people that don't know your practice, like who's your typical patient that's coming in for like a smile makeover?
Sure. So as a prosthodontist, my patients, you know, they're patients, they're people, they're amazing people, but they can't chew, they can't eat. They're not smiling, and they've been going through a lot. And
like really bad teeth. I mean, you see the people that really have broken down teeth.
Yes.
Is that right?
Yes. And, you know, many different ages, you know, many different backgrounds, cultural backgrounds, many different, you know, walks of life. Good people, you know, people that have been trying, and they maybe haven't had all the answers either given to them or have been to places that aren't working for them.
Okay.
So this is my expertise. I am an expert in being able to help them find the answers and getting it done. So they come to me and we're able to figure out a plan, and then I am able to execute that plan. I give them options, and then we're able to figure out, with everything that is going on for them, which option is best suited for them. So we take people a lot of times with broken down mouths, and in one afternoon, change, and they're back to having a functional, beautiful smile.
Now you say people, I mean literally, and we should mention, you worked at one of the busiest centers in America.
Yes.
And you have a lot of experience in this full mouth reconstruction or this full mouth makeover. Is it true? So somebody could come in with a complete broken down mouth.
Yes.
And on the day of the procedure, they could walk out with a beautiful set of veneers or a beautiful set of teeth.
Absolutely.
Brand new teeth.
You know, as a prosthodontist, there's a lot of planning that goes involved. It's not wham, dam, boom, here's your teeth. You know, this is my specialty that I have so much passion for. And, you know, I get super excited because when somebody who comes in and is suffering and who's been through so much comes in and they're a little frustrated or a little scared or a little disappointed, I actually get a little happy for them because I already I can see already the transformation in my eyes for them.
So they're like telling you a hard luck story on the console, but you see like the future and you're getting excited.
Yes, I'm actually sitting across from them like this, and I'm already envisioning what I can make them look like.
Do you have to like hold back your smile
I
sometimes?
do, or my like internal excitement, because I have so much passion for what I do, and sometimes I just want to like start them right away.
They don't even know how good it's going to be?
Yeah.
Really?
Yeah. So, I mean, even right now, I'm just getting excited thinking about
teeth, right?
Randy,
and I know you're a prosthodontist and you think it's a big deal, but really, it's that big of a deal?
It's not just teeth. I mean, Randy, you have a beautiful smile, and you know, a lot of people are given a gift of very beautiful functioning teeth, but there's a lot of people out there who have not been given wonderful teeth or functional teeth.
Okay, fair.
So, you know, teeth, our faces, our bodies, our health, our wellness, the way that we express ourselves, our personalities. And there's so much more that our mouths, our teeth, everything that it does for us, our digestion, everything. I mean, there's so much.
You were on television with me before. I interviewed you before.
Yes.
You said people would come in, they literally thought they had no hope. And they would go to you, and they're still skeptical. Like, are you sure, Dr. Mackie, you could do this? Is that right?
Yes. And you know, I've seen and been a part and been, you know, honored and privileged to have helped so many people and have been a part of so many transformations. I feel so thankful that I've been, you know, trained and experienced to be able to do this. It's just great. And this is why I'm here, to be able to share my passion and to be able to help so many more people. So anyways, back to patients and people who are going through a lot, and they'll come in, and you know, we want to figure out a way to help them because they've been through so much, and we want
Like
to
not smiling, not being able to eat,
yes,
low self-esteem,
right.
all of that.
People want to live their life. People who have been down and out want to live their lives again.
Is it like anything else? Like you know, you start losing your hair, you're self-conscious about it, holds you back.
It holds you back.
You gain too much weight, you don't want to go be
Yes,
social.
exactly.
Is the same thing with teeth? Like people with bad teeth, like they kind of
Yes.
withdraw?
Right. And you know, I'll show you some pictures and some stories, but you know, there's a lot of people out there who, you know, they stop doing the things they love. People
Because of their teeth.
Yes, they're self-conscious. They don't want to go on dates. That's for sure.
They tell you that.
Yes, all the time. And it takes a lot of courage to share these stories. And I really feel happy that I can be a person that people can confide in. And I really love to have these conversations with people because, you know, in life when you're self-conscious about something, you don't act the way that you really want to act.
So you see these transformations, like you give somebody a brand new smile, right, with veneers or cosmetic dentistry, and you say they act differently.
Yeah.
Like they're like new people.
Yes,
Really?
it's shedding your skin. It's, you know, peeling off your banana, and you're peeling yourself off, and you're showing your real true
Really?
self. Yeah, you know, there's a saying in life: the comeback is always stronger than the setback. So
Good.
yeah, so they want to come back. They want to be them again. So when somebody's been walking around with no teeth, wiggly teeth, loosey-goosey teeth, bad breath, you can't go out to eat, you can't kiss a girl or a guy, or, you know, smile or be you. You know, people will be like, oh, why is that person mad? Or, oh, why do my coworkers think that I'm always upset? Or I can't smile in a selfie, or I always feel like I'm frumpy, or I have to grow my beard extra long, or I have to put my hand
And that all
in
changes.
front of my mouth. It changes.
Like in a minute? Like
Well,
when it's all done, that first time they look at the mirror?
So for some people, yes. For some people, they have to say, Doc, I have to practice how to smile. But it'll come because then their true emotion can come out. And I like to tell people, you know, when they go out or they want to tell a story or have a drink or do whatever they want to do, it's like that no holds bar. It's like, boom, be you. You know, laugh really big or just let go. Like finally be who you want to be instead of feeling like you have to hold back every moment. And I also like to say,
It's nice.
instead of having that, you know, that brick in the back of your head that's always weighing you down, that you have to think about, how am I going to disguise this thing that's always making me think about every little waking moment? Shed it, let go, be you. So that's
Nice.
something that's really awesome.
Good for you. You brought photos. Let's
I
take a look
did.
at some of these extreme smile makeovers.
Great. So this is one of my favorites.
Okay.
Steven is suffering from something that a lot of people go through. It also has a genetic component, meaning you get it from mom, dad, grandma, grandpa,
What is it?
down the lineage. It's a gum disease.
Okay.
A gum disease that makes teeth loosey-goosey.
Like a bacterial infection.
Yes.
Okay.
Through the bloodstream onto the ligaments which hold the teeth to the gums. You can brush 15 times a day. You can go to every deep cleaning every 3 months. It's really not going to help. The teeth are going to get long. The teeth are going to get stuff stuck in between. They're going to splay out. They're never going to look pretty. They're going to get loose.
Okay.
He confided in me. He says, Doc, I can't go out. I can't go with my dad out to dinner.
Okay.
I have no front tooth. I cannot meet a girl. And this is a man in his late 30s. His coworkers, he can't talk to them and feel comfortable.
Okay.
So we had to do his treatment. And not only do his treatment for him and his function, but for his health too. So step one, we have to clean up the infection, right? We gotta get rid of all of that. So, you know, like I said, we can change someone's life in a few hours.
Okay.
For Steven, here is Steven in a few hours. Now these are his temps
Okay.
after the procedure. Look how handsome he is.
He does. He definitely looks better. Yeah,
He is a happy man. He is much healthier, and he is confident. Now, like I said, Steven can now show who he really is.
Okay.
Steven is confident. Steven is feeling great. Steven messaged me the night of his surgery. And again,
Like a text message.
yeah, an email
Okay.
with an attached picture. And Steven's confidence was great, and Steven wanted to show me a picture of his smile.
Okay.
And like I said, their true self comes out. And their true self comes out, like I said, in a matter of a few hours for some people.
Okay.
Steven's looking good, Steven's feeling good, and Steven feels now he can show his true self. Here is Steven showing his true self and feeling super confident.
That same night, you get a text
here he
or
goes.
an email.
Look at how
A
handsome.
shirtless photo.
Yes.
Classic.
He is so handsome. He is so confident.
He's probably irritating all of his friends on Facebook now with all these selfies, right?
Yeah, but
Looking good.
he looks amazing. And, I felt really honored and happy that he was able to show me this photo, because it showed me that he's just feeling so much better about himself. And I was able to help him get there.
So good physique, looking good.
And
he just had bad teeth before.
He had that physique with those bad teeth, but how can you have that situation happen and take that kind of selfie with those bad teeth? He wants to go to the pools. He wants to, go to the gym. He wants to feel like that all the time. But with his new teeth, he can really express that and feel that confidence.
So how long does a guy like this, what do they say? How long did they not like their smile? Did they put off doing anything?
Yeah. So, it really started kicking in, probably a good 5 years he wasn't smiling.
Okay.
It got bad then, yeah. But made it happen for himself. So now he's smiling away and much healthier, much more energy. The bacteria is gone, feeling better, able to eat better, everything. Let me show you this cosmetic, aesthetic, prosthodontic makeover.
Okay.
All right.
You're proud of these. It's like you're showing me baby pictures.
I am. I love my specialty. I love what I do. So this is Todd. Okay.
All right.
So Todd, went through the ringer with his dental history. He had a lot of pain. He had a lot of broken down teeth, a lot of wear, a lot of breaking, a lot of just so many things.
Okay.
A lot of fear too. A lot of things that didn't work for him. And he had a lot of frustration. So he came to me and, he had a lot of concerns. He had concerns about his breaking down teeth, the pain, the numerous amount of visits at other dental offices that weren't working for him. The aging look. Todd's a handsome guy overall.
Okay.
He was talking to me about how his face was looking smushy because everything was sinking in, and the aging look.
Okay.
And, he was mentioning all these concerns, the bad breath from the decaying teeth and everything that was just, making him feel self-conscious. He wasn't able to date. He wasn't able to do all these different things. So, we discussed everything, and he felt comfortable, and, he started to feel like, okay, this is, a good plan for him. So he started like this, and, in one afternoon, we are able to change his life.
Okay.
And let me show you how handsome and how great he looks.
Let's
Here
take
is
a
his
look.
after.
He is looking pretty good. Wow. Very nice.
Young, healthy, handsome. He looks great. And, as a prosthodontist, aesthetics, cosmetics is my forte. We are...
Because they look natural.
They look
I told you in
natural.
the green room, I said, I feel like I could spot fake teeth walking down the street.
So as a specialist, as a prosthodontist, aesthetics, cosmesis is my specialty. I'm measuring, I'm following the eyes, the nose, the lip line, the nose to chin dimension, the envelope of skin, the jawline. All of that is measured, and I have special tools and mouth machines that gauge all of this. So it actually supports the envelope of skin with the jaw, the lips, the nose, everything. It's really cool.
Okay.
So I have patients that joke about mini facelifts and stuff after their teeth are done because of the support that the teeth give. So as a side note with Todd, let me show you what the teeth did just for the profile and the jaw. Remember, he had a complaint about the smushiness. So here's Todd's before profile.
Okay.
So some patients will tell me, why does their chin look witchy or jet out or smushy?
Why is that?
Yeah, it's because the teeth are broken down, really worn or missing.
So the nose gets closer to the
right, because of the
chin,
jaw joint dimension, it's all smushy down.
Okay.
And now look how supported and nice that profile is.
Oh, wow.
Yeah, it's a really cool benefit.
You see it when it's side by side.
Yeah, it's amazing.
I mean, it looks like his chin, like it chopped off part of his chin. It's just...
It's really nice and straight, and it's supported. So it's a really great benefit that happens when you have your teeth back. Randy, go ahead and go back to his before and after.
Okay.
Please. Would you say he looks more handsome?
Yep. Yes.
Yeah. Would you say he looks younger
Yes, he does.
and healthier?
Yes. More sophisticated.
Yeah.
More educated.
Yeah, he's a very smart man.
So I take it back when I always say it's just teeth. Yeah. I guess it's more than that. Good.
Much more.
So what happens when, I mean, to this guy? He comes back.
He said, he goes, wow, I'm sure glad I don't have to be that guy anymore. He said that to me.
Is that right?
Yes. Swear.
So it's kind of like a different person in
Absolutely.
a way for many people.
Yes. And he doesn't have to undergo that pain or those bad experiences anymore. You know, it's funny, you change their smile and they start dressing differently. Their charisma is back. Their mojo is back. They really, they light up a room. It's amazing.
That's true. I mean, people are drawn to people. I mean, confidence is attractive. It's sexy.
Confidence is number one. And, the smile, the face, the eyes. These are all the things that when you read magazines or you go on bloggers or you look at all the social media or all the things out nowadays, this is what people are drawn to. I mean, that's why when you send texts now, everyone uses emojis.
Yeah. So smile's part of the whole package.
Of course, the whole package.
With cosmetic dentistry, like veneers, let's say veneers for a second. How do they know, how do you design, how do they know what it's going to look like when it's all done?
So I have a lot of different ways I like to map out patients, but it's really harmony of their own face. And, I talk to them, I watch the way that they laugh and the way that their lip line goes up and the dimensions of their face and their nose and, when they talk and how their front tooth should be and the characteristics of a male and a female and their speaking zone and their smiling zone. And, the way that their jaw opens and closes. And, there's so many intricate details. I've been told, oh, doc, you're like a mini architect. Or, oh, doc, you're like a little baby engineer. As a prosthodontist, yes, I am. I am like a little architect or a little engineer because we are the masters of design, art.
So does it cost more to go to a prosthodontist, a specialist, to
No,
get your teeth done?
not at all.
Over a general dentist?
No, not at all. Come to me. I always like to say, let's get it done right away, the first time, so that we don't have to do any repeats. And I really take pride in doing it the proper way, step by step, very meticulous and understanding, all the materials. And I like to say, I plan for longevity. I plan for what is best for them. And I always say that we're never going to finish until they're happy.
Okay, good. You have more photos. What are we looking at?
Yes. So here I have Iman. She's a beautiful lady with this gorgeous, platinum blonde hair. And she loves to talk and be with her extended family. She has grandkids. They're super cute. And I really love her whole family. And she loves to talk. She loves to be, with them. And she likes to eat ice cream and all this stuff. Her teeth were so sensitive, the air, the wind would make her teeth hurt.
Really?
Yes. And she couldn't stand it. Also, the gaps in all of her teeth, when she would talk, spit and stuff would come through. And this would make her extremely, extremely embarrassed. So she came to me And, we came up with a really great plan for her. And her kids were awesome, super supportive. And, she wanted to continue to have her vivacious personality with her platinum blonde hair and her gift of gab.
Okay.
So, here is my beautiful Iman.
Very nice.
Yeah. Happy.
Wow, big difference.
Able to eat her ice cream, talking with no, spit coming out.
So the cold sensitivity went away.
Gone.
Okay.
Gone. She is able to eat her ice cream she talks about. She's able to be, living her life in the center of attention with her family as she should be, the matriarch. So look at that after. She feels so confident. She looks gorgeous.
It does. I mean, it's changed. You said before that a smile can make you look more attractive.
She looks stunning. She's loving her life.
So some people come to you and say, Dr. Mackie, this is probably the worst thing you've ever seen.
Yes.
I think you've told me that. They literally don't realize that they're even candidates for cosmetic dentistry.
Right. They think they're the worst because they're not a dentist.
And plus they don't see it, right? You say they don't smile. These
right.
people.
And they're not going to be sitting in, a circle comparing with a bunch of people because that's embarrassing. So, I like to reassure them that they're not the worst because they're probably not. I've seen the worst.
Okay.
But, I like to ensure people that they're fixable.
Can you ever be too far gone?
No.
I mean, you haven't met that person yet?
In fact, I don't think I've ever turned anyone away. I don't really think I have.
We should mention as a prosthodontist for a second that general dentists, because you're a specialist, general dentists send you their complex stuff.
Yes.
When the mouths are falling apart, it's like, because I've talked to my general, he goes, they need to see a prosthodontist because their training is limited in this department.
Yeah.
And I think the public thinks and this is what I've learned from 20 years doing the show, that the public thinks that all dentists are doing it the same way. They don't realize the differences. So do you have a bias? Do you believe, hey, if you're going to get cosmetic dentistry done, if your mouth's falling apart, see a prosthodontist?
Yes. No, I mean, there's great qualified general dentists out there. My dad.
Yeah.
But as a board certified prosthodontist, I have had extensive training in very complex
In the
cases.
complex stuff.
Yes.
Because I know you came on the show, you go, I don't want to say anything negative about any other dentist, which was nice.
Yeah.
Right? Because there's qualified people out there. But you pretty much, and I don't want to put words in your mouth here, but if you go to a prosthodontist, board certified prosthodontist, you pretty much know these are the people that can handle extreme makeovers.
Yes.
Is that right?
And I'm able to give patients a lot of options that suit their needs.
Okay.
Because every person is going through a little something different in their life. I had a 29-year-old amazing person come to me just this past week. And 29 years old, they have their whole life to live. And they're suffering from something where they went to another provider and that person said they need dentures. Well, that's just not happening for that 29-year-old person. That 29-year-old person has an awesome job and wants to go get married and travel and live their life. They came to me and I had all these other options with implants and all this other cool stuff, bridges, fixed teeth and all this other great stuff that works better for them in their life. So, as a prosthodontist, I'm able to give them, better options that suit their life, that are still natural and beautiful and that are permanent and that, that they love.
Now we're short on time, but more and more plastic surgeons are starting to send you patients. In fact, on that famous show, Extreme Makeover, the plastic surgeon on the show told me, he said, Randy, and it was on my show, he said, the smile made the big difference, the biggest difference.
Yes. And I love my plastic friends. They're amazing. But when it comes to, let's say, that elective stuff for the body, that's more of, a choice to make somebody feel better. And, if you're looking at an ad and you see a beautiful woman in some clothes, what's going to shine the most? It's going to be her smile.
Okay.
Even if it's an ad for the clothes, it's going to be the smile that shines.
We are out of time. Final message. The group of people, they have really bad teeth. They don't even know their options. They don't think they can be helped, and they've heard what you had to say.
Yeah.
But for whatever reason, they're still afraid.
Yeah.
They're going to put it off.
Yeah.
Especially guys, we put it off. We're in so much pain. So what do you say to them? They don't like their smile, and they're doing nothing.
I'm saying, come and see me. I'm here to help you.
Okay.
I'm here to make you feel comfortable. I'm here to give you options. losing teeth is expensive, going through all of these other.
You say you want to save teeth when you can.
I'm saying I want to help you to give you options.
Okay.
So that you can figure out what is truly the best way so that you can have comfort. You can have a beautiful set of teeth that has longevity, and that it's not just one thing and you're not forced to do something. I want you to feel super comfortable, and I want you to get the best treatment and feel happy, and know that you have a person who really cares about you doing this.
Okay.
And just to feel really at ease and feel you again. And I'm really looking forward to helping you and getting you back to getting your mojo back.
Good. It's a free consultation.
Yes.
I mean, do you still see patients?
Yes.
You'll meet them on the consultation.
Yeah.
And now we should mention, because we get emails, insurance, even the best dental insurance only covers max out about $1,500 a year.
Yeah.
Medicare, Medicaid doesn't cover this at all. So what's the answer?
So there's financing. And,
Are people financing this?
Oh yeah, all the time. We have really awesome patient treatment coordinators, advocates. So somebody has to have decent credit.
Okay.
But I have my, patient coordinators to help, walk people through every step of the way, so that, they're well informed with, everything that they need to do on that logistical end.
Okay, good. What if you're a dental phobic? What if you're afraid? You guys offer sedation?
We do, yes. So, actually I love working with dental phobics.
Really?
Yeah, because their mind changes when they come to see me. And, they're put at ease, and we have lots of different ways to make it really comfortable for them. So, come on in, let those bad experiences of the past be gone, and just move forward and start anew now, Like I said, the comeback is always stronger than that setback.
When you hear, I'll see ads that'll say, change your smile, change your life, but you actually believe it.
Right.
That's what I like about you. I mean, you believe it'll change somebody's life.
Mm-hmm. Well, I see it every day, and I've seen thousands of them. So
you get your teeth fixed, and then they send you a selfie of themselves without a shirt.
Yes.
That evening.
Yes.
Smiling.
Yes, or stories, or messages, or, pictures of events or food, or just different things, or, a story that, they have a significant other in their life, or just different things, or just so many cool comments or stories, or just everything. It's awesome.
Okay, good.
Yeah.
Dr. Mackie, always a pleasure to have the show.
Pleasure, Randy.
Good
Thank
stuff,
you.
Good stuff.
Thank you.
Thanks for coming on. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.